Hello, and welcome to the Hatch training on workplace violence. My name is Abby. I'm a content writer on the training and marketing team for Hatch, and we're happy to have you here today.
Hello, my name is Kirsten, and I'm a researcher and also part of the training and marketing team here at Hatch. We're excited to dive in.
All right, let's get started. So on today's agenda, we are going to define workplace violence. We'll identify risk factors for prevention. We'll talk about roles and responsibilities for staff, processes for follow-ups of victims, reporting requirements, staff education recommendations, and Hatch features that will assist with workplace violence reduction.
Great. Well, let's go ahead, and I wanted to just kick off this training talking a little bit about what constitutes workplace violence, because it's kind of a broad topic. So the definition of workplace violence is any act or threat of physical violence, harassment, intimidation, or other threatening, disruptive behavior that occurs at the worksite. It ranges from threats and verbal abuse to physical assaults and even homicide. And it can affect and involve employees, clients, customers, and visitors. If you're part of healthcare companies, it's also, patients who can be impacted by workplace violence. Well, among those with higher risk are workers who exchange money with the public, delivery drivers, healthcare professionals, public service workers, customer service agents, law enforcement personnel, and those who work alone or in small groups. Many American workers report having been victims of workplace violence every year. Unfortunately, there's even more cases that go unreported. So, research has indicated that there are certain factors that increase the risk of violence for some workers at certain work sites. As we mentioned earlier, there's a couple groups in particular that are at high risk. Also, there's other factors, including, people providing services and care, working where alcohol is served, can also impact the likelihood of violence. Additionally, time of day and location of work, such as working late at night or in areas with high crime rates, are also high risk factors that should be considered when addressing areas of workplace. And kind of the last big one is working with volatile, deemed kind of unstable individuals or high emotion individuals. These are all different factors that put people at higher risk. Obviously, you'll see kind of time and time again, you'll notice that healthcare workers, especially people in the substance and mental health field, are kind of have multiple factors here. Obviously, the profession is already mentioned. Also, we provide a service. Sometimes we work alone, or in small groups. Sometimes we work late at night. Sometimes we're working with people with high or heightened emotions at the time. So definitely important for us to kind of go through this, as a lot of people that are watching this right now are part of healthcare companies or behavioral health companies that could be or have been impacted by workplace violence.
So how do we define this? How do we define those boundaries versus what are the rights of the client? So here we have a chart that breaks down types of workplace violence, the definition, and then some additional notes. So for type 1, the criminal intent. In type 1 violence, the perpetrator has no legitimate relationship to the business or its employees and is usually committing a crime in conjunction with the violence, such as robbery, shoplifting, trespassing. For example, a nurse assaulted in the hospital parking garage, a home healthcare nurse is mugged while conducting a home visit, or in healthcare settings, type 1 violence occurs less frequently compared to other types of violence. And we have type 2, the customer client. Type 2 violence is the most common in healthcare settings. The customer-client relationship can include patients, their family members, and visitors. Research shows that this type of violence occurs most frequently in emergency and psychiatric treatment settings, waiting rooms, and geriatric settings, but this is by no means just limited to these. Then we've got type 3, worker on worker. Type 3 violence between coworkers is commonly referred to as lateral or horizontal violence. It includes bullying, offensive or vindictive and or humiliating, though it can range all the way to homicide. Worker on worker violence is often directed at persons viewed at being, quote, lower on the food chain, such as in a supervisor to supervisee or doctor to nurse, though incidents of peer-to-peer violence is also common. And then finally, type 4, personal relationships. In type 4 violence, the perpetrator has a relationship to the nurse outside of work that spills over into the work environment. For example, The husband of a nurse follows her to work, orders her home, and threatens her with implications for not only this nurse, but also for her coworkers and patients. From 2016 to 2020, there were 207 deaths due to violence in the workplace in the healthcare and social assistance industry. In 2020, healthcare and social assistance workers overall had an incidence rate of 10.3 out of 10,000 full-time workers for injuries resulting from assaults and violent acts by other persons. And data obtained from nurses is a major population-based study, showed a rate of physical assaults at 13.2 per 100 nurses per year, and at a rate of 38.8 per 100 nurses per year for non-physical violent events.
All right, so we're going to take a moment to take a break. I know we've just started, but also we've reviewed a lot of information already. So we're going to do a quick true or false. So true or false, workplace violence is a physical act of aggression against someone while at work. Please take a moment to pause this training, think about your answer, and when you're ready, you can go ahead and hit unpause, and the answer will be on the next slide.
So if you answered false, you're correct. Any act or threat of physical violence, harassment, intimidation, or other threatening disruptive behavior that occurs at the worksite, it ranges from threats and verbal abuse to physical assaults and even homicide, and it can affect and involve employees, clients, customers, and visitors.
All right, so we talked about earlier having risk factors. So now we want to do a little deep dive, talking a little bit more. We're going to start off with talking about patient, client, and kind of setting related risk factors as it pertains to workplace violence. So we have a list here of some that we're going to go through, starting off with working directly with people who have a history of violence, abuse or use drugs or alcohol, gang members, and relatives of patients or clients tend to be much more likely to commit acts of workplace violence. Individuals that are transporting patients and clients are at higher risk, working alone in a facility or in a patient's home. Poor environmental design of the workplace that may block employees' vision or interfere with their escape from a violent incident. Poorly lit corridors, rooms, parking lots, and other areas. Lack of means of emergency communication. Prevalence of firearms, knives, and other weapons among patients and their families and friends, and working in neighborhoods with high crime rates. So it's really important to be mindful as we're kind of looking at these risk factors. Just one of these things is not an indication that there's going to 100% be workplace violence or that it's a dangerous place to work, but it is something to be mindful of, especially, as we talk later, we'll talk about how to make plans and preventative efforts, but it is important to just be aware of these things and support your staff, create policies, and create resources to help reduce the chances of these playing a role in impacting people. So we just want to be really clear, starting off with working directly with people who have a history of violence, drug and alcohol use, gang members, and relatives does not mean that we should not provide drug and alcohol use support, or that we shouldn't support individuals that are, have a history of violence or history of gang affiliation. But it is something for us to be mindful of, and then just be intentional as we're creating policies or building resources or training our staff to make sure that they have the right resources to be supported in those things. It's not that we can't transport patients and clients, but maybe it's that we have two workers in the vehicle when we're transporting to assist if there is a crisis or a situation that arrives, or checking to make sure that people that bring bags with them during transportation, make sure that there's no weapons there, right? So just wanted to note that as we kind of continue, the next slide will also be about risk factors, and we just want to make sure that we're not saying that these things mean that you have to get rid of these things or that 100% there'll be workplace violence, but it's just something to consider so that we can have a really intentional plan. Abby, do you want to take on the next set of risk factors?
Yes. So now let's look at organizational risk factors, which includes lack of facility policies and staff training for recognizing and managing escalating hostile and assaultive behaviors from patients, clients, visitors, or staff. Working when understaffed, especially during meal times and visiting hours, high worker turnover, inadequate security and mental health personnel on site, long waits for patients or clients and overcrowded, uncomfortable waiting rooms, unrestricted movement of the public in clinics and hospitals, and perception that violence is tolerated and victims will not be able to report the incident to police and/or press charges.
So exactly what we were kind of just talking about on the last slide. It doesn't mean that just because we're understaffed, that doesn't mean that 100% there's going to be violence, but it's definitely something to consider. And when we're looking at our staffing pattern, it's really important to be intentional about meal times, visiting hours, and reducing that, seeing what we can do to ensure that we're not being understaffed.
Yeah. And again, I think it's about, raising awareness to make sure that you're aware when these things are coming into play, the risk factors do go up. So.
Yes, absolutely. Thank you, Abby.
Now we're going to go into prevention.
Yeah, well, I think we'll kind of deep dive more into kind of the responsibilities of leadership and training and kind of dive in more. But at a high level, from our perspective, what we really recommend for kind of the building blocks of developing an effective workplace violence prevention program is one, having management commitment and employee participation. So strong believers that a lot of this work starts at the leadership level. This is not something just because you don't interact with other clients or that you interact with the visitors, doesn't mean that you don't have a role to play in helping to prevent this workplace violence. So really it's up to leadership to set a commitment, provide resources, provide training, education opportunities, all that good stuff, and up for employees to participate and engage in those. Worksite analysis. So if you are part of a healthcare company, there are facility walkthrough resources that we'll talk about a little bit later, specifically in Hatch, but really looking at your site, because as we talked about in the recent risk factors, things like, emergency communication, the lighting in corridors, stuff like that, separation, ability for people to leave in the event of an emergency, all those things would be determined during a worksite analysis. So really important, not only for us to look at policies and people, but to also look at our environment and the setting that we're in, and is it set up for an emergency to occur. Kind of on a similar note, hazard prevention and control. This can include things like, just being cognizant of weapons, and hazards could also be like emotional hazards. Like if someone is having an emotionally distressing moment, or having an intense reaction, where can they go? Where can they be separated? Where can they be safe? What is the staff training in terms of that? Is there chemicals? Is there potential items that could be used as a weapon that are in close vicinity? Just those types of things. It can really range. There can be a lot of different things that could become hazards, but something to kind of be mindful of and be aware of. Safety and health training. So we'll have a whole section talking about staff training, but being really aware of that and making sure that that's being evaluated as a part of the workplace violence prevention program is critical. And then last one, record keeping and program evaluation. If you have watched any other Hatch trainings with me and Abby, you have probably heard us say, and I will say it again, if it is not documented, it didn't happen. This is one of the guiding stones that I think a lot of us in healthcare believe, but especially at Hatch. We are team documentation. Record keeping is our friend. We love it. We need it. We want some more of it. And so we'll talk through how to do that in Hatch in particular, but really critical that we are having really accurate and timely record keeping and program evaluation done as a part of the workplace violence program.
Great. Thanks so much for taking us through those. Let's pause and do a pop quiz. So, which of the following items below were not mentioned as a risk factor? Refusing to transport patients and clients, working alone in a facility or in patients' homes, poor environmental design of the workplace that may block employees' vision or interfere with their escape from a violent incident, poorly lit corridors, rooms, parking lots, and other areas, or was it lack of means of emergency communication? So pause the video if you need to think about it, and when you're ready, hit play and we will let you know the answer.
Hello and welcome back. If you said refusing to transport patients and clients, you are correct.
Great, so now let's move into what is the relationship of leadership. So effective management leadership begins by recognizing that workplace violence is a safety and health hazard. Management commitment, including the endorsement and visible involvement of top management, provides the motivation and resources for workers and employees to deal effectively with workplace violence. This commitment should look like acknowledging the value of a safe and healthful, violence-free workplace and ensuring and exhibiting equal commitment to the safety and health of workers and patients or clients, allocating appropriate authority and resources to all responsible parties. Resource needs often go beyond financial needs to include access to information, personnel, time, training, tools, or equipment. Assigning responsibility and authority for the various aspects of the workplace violence prevention program to ensure that all managers and supervisors understand their obligations. Maintaining a system of accountability for involved managers, supervisors, and workers. Supporting and implementing appropriate recommendations from safety and health committees. Establishing a comprehensive program of medical and psychological counseling and debriefing for workers who have experienced or witnessed assaults and other violent incidents, and ensuring that trauma-informed care is available, and establishing policies that ensure the reporting, recording, and monitoring of incidents and near misses, and that no reprisals are made against anyone who does so in good faith. Additionally, management should 1, articulate a policy and establish goals, 2, allocate sufficient resources, and 3, uphold program performance expectations.
Wonderful. And I know that was a lot of information, Abby. Thanks so much for going over all of that. But, I think the kind of down at the bottom, I think it really touches on the larger message that, management's main role is to set a policy and establish goals, and then help their workers be successful in that, and it kind of breaks down in your bullet points the different ways that they can do that, whether it's creating a system or allocating resources, authority, assigning job titles, all that sort of stuff. But it really, all that comes down to okay, you can't just say it. Now you've got to help people to be able to do it. And when people aren't doing it, you need to reinforce that and hold people accountable, and set expectations. I think that's if we break it down, those are kind of the 3 things, and it seems easy. Obviously there's a lot to it, and there's a lot that needs to get done. But it's critical. It's at minimum emotionally, or mentally harmful to your staff, but at a worst case scenario, it could be life-threatening. So really critical that people are feeling support from their leadership, and that leadership is feeling really confident that they are doing their part to help support the organization.
Mm-hmm. Totally.
Talking a little bit about just kind of the roles and responsibilities in the program, and kind of debriefing on this a little bit more, we did also want to add the general duty clause from the OSHA Act of 1970, which requires that in addition to compliance with hazard-specific standards, all employers must provide a work environment, quote, free from recognized hazards that are causing or are likely to cause death or serious physical harm, end quote. Workplace violence is a recognized hazard within the healthcare industry, and as such, employers have the responsibility via the Act to abate the hazard. The Occupational Safety and Hazard Administration, also known as OSHA, relies on the general duty clause for enforcement authority. So this is not, this is not just best practices. This is not just it would be, besides the fact that you should do this, you have to do this. And, we really would hope, and I think Hatch has such amazing partners where this really isn't a concern for us, that people would want to do this for their employees, for their clients, for, just because it aligns with organizational values that the healthcare company is participating in. But we just wanted to flag this as just a reminder for everyone that it is the responsibility of any employer to do their part. Doesn't mean that workplace violence won't still happen. You can't prepare for absolutely every scenario, but that you are working really hard, and they are actively engaging in efforts to reduce the risk as much as possible.
How about another pop quiz? What are the 3 additional responsibilities of leadership when looking to reduce workplace violence that were mentioned? Pause the video, think about it, and when you're ready, press play and we will let you know the answer.
Hello and welcome back. So the 3 different additional responsibilities of leadership when looking to reduce workplace violence that were mentioned earlier are 1, to articulate a policy and establish goals, 2, allocate sufficient resources, and remember those resources can vary from money to equipment to training to staff, and then 3, uphold a program performance expectation.
Okay, let's talk about processes for follow-up and support to victims or witnesses, including trauma and psychological counseling if necessary. When an incident occurs, the immediate first steps are to provide first aid and emergency care for the injured workers and to take any measures necessary to prevent others from being injured. All workplace violence programs should provide comprehensive treatment for workers who are victimized personally or may be traumatized by witnessing a workplace violence incident. Injured staff should receive prompt treatment and psychological evaluation whenever an assault takes place, regardless of its severity, free of charge. Also, injured workers should be provided transportation to medical care if not available on site. Victims of workplace violence could suffer a variety of consequences in addition to their actual physical injuries. These might include short and long-term psychological trauma, fear of returning to work, changes in relationships with coworkers and family, feelings of incompetence, guilt, powerlessness, and fear of criticism by supervisors or managers. Several types of assistance can be incorporated into the post-incident response. For example, trauma crisis counseling, critical incident, stress debriefing, or employee assistance programs may be provided to assist victims. As explained by the Substance Abuse and Mental Health Services Administration, trauma-informed services are based on an understanding of the vulnerabilities or triggers of trauma from survivors and can be more supportive than traditional service delivery approaches, thus avoiding re-traumatization. Whether the support is trauma-informed or not, certified employee assistance professionals, psychologists, psychiatrists, clinical nurse specialists, or social workers should provide this counseling. Alternatively, the employer may refer staff victims to an outside specialist. And in addition, the employer may establish an employee counseling service, peer counseling, or support groups.
Wow, that was a lot of information, Abby. What do you think is kind of, there's so many things that were important here, but what do you think is kind of one of the biggest takeaways maybe that comes to your mind when you're looking at the list of how people could be impacted by trauma or some of the different ways that leadership can support victims?
I think it's really easy to overlook the people who might be impacted psychologically through events. And I mean, this list of like fear of returning to work, changes in relationships, a lot of things are getting impacted here that I think are really easy to just not think about, especially if you're a staff member that didn't witness it or wasn't involved and you're working on it. So just being really cognizant and aware of the list of things that could go on for your staff and people that were involved in this. It's not just about somebody being injured and then dealing with that. Obviously, that's incredibly important and that's going to be the first thing you do. But I think all this other stuff has a long-term impact that we need to be aware of and address and take really seriously. Do you have anything to add?
Yeah, I think you bring up a great point that I think it's so easy, especially when whatever the event is, especially if the event has a physical component, I think it's really easy to focus on other individuals that maybe were physically involved and sometimes maybe miss the individuals who were present, but maybe not physically impacted, or honestly, even people that weren't there, but maybe, could have been there or feel like there's some similarities that then have concerns. Mm-hmm. And I think where I see this issue come up a lot, within healthcare is we often have people that all are doing the same job, right? So we usually don't have just one nurse on staff. We usually have multiple nurses on staff or multiple therapists. And so it's really easy to focus on, and we should, of course, make sure that we're supporting the individuals that are directly impacted. If someone went and assaulted or attempted to assault or harassed one specific nurse or one specific therapist. Absolutely, we need to support that one individual, of course, and that should be our immediate priority. But I think it's important to remember that individuals that maybe have that same profession or in that same position might also be scared and nervous now, right? Because like they've seen it happen to someone else that is doing the same work. Maybe they were supposed to work that day, maybe they weren't, maybe they were working, but they, were working with someone else, where they might have a bit of that, like, oh, that could have been me, which can be really scary and can be intimidating and could cause guilt, right? Maybe someone covered a shift and violence happened and the person whose shift they covered is feeling guilt. And so I think that that's something that I would know, is that I think it's really our natural response, of course, and I think as it should be, is to support the individuals that are, most critically impacted directly. But I do think it's important to be thoughtful and intentional that it could impact people who maybe weren't even present, but maybe have similar connections or, and just follow up. And part of that comes with leadership communicating next steps, and recognizing that assistance needed afterwards might be needed for more than just the people involved. Can we open that up to other people? And can we have some debriefing, some, whether that's like critical incident stress debriefing or just like operational, like here's what we're going to change or do differently next time or whatever. That's, I think that debriefing and communication afterwards is so critical, and not just to those impacted, but to the whole team, so that they're like, okay, this happened. It was terrifying that it happened to, Susan or Frank, whoever the root people involved with. And here's how we're going to ensure it doesn't happen to me either. And I think that that's a totally reasonable response. And some people might feel guilty about feeling that, but I think that that's normal. How could we not? So I think that that's something to just kind of keep in mind.
Yeah, totally. Be prepared for this to impact everybody that's involved in the organization or center. Yeah.
And there might be people that are totally fine, feel good. And they're like, you know what, that's weird, one-off, it won't impact me, ready to go in. That's great.
But it's better to be prepared for it to impact everyone.
Absolutely. Put it out there. And if people need that additional support, great, let's get it to them.
Yep. Love it.
Wonderful. Well, speaking of, just kind of like next steps, the next big thing I want to talk about was incident reporting. So once, the immediate needs are taken care of, we should really move on and move into the investigation portion. And that should really begin promptly. So basic steps in conducting incident investigations are: 1, report as required. So determine who needs to be notified, both within the organization, outside of the organization. That could be law enforcement. When there's an incident, if the incident involves hazardous materials, additional reporting requirements may apply as well. When you're reporting, you should involve workers in the incident investigation. So typically, what we see at healthcare facilities is like usually the kind of on-site, maybe highest leadership is involved in informally, like, opening an investigation or starting the investigation, but that doesn't mean that they're the only ones that should be involved in collecting that information. They should definitely engage anyone who heard it, saw it, supported in it afterwards. This is really a collaborative effort to make sure that we get all of the information absolutely possible. Next one, we're going to identify root causes. So identifying the root cause of the incident is critical for us to be able to look back later and kind of figure out what happened. So don't just stop an investigation at, oh, that was a worker error or it was unprecedented. We really want to understand like the why. Ask why the person, whether it's the client or staff or whoever, why did they act that way? Why did that happen? Why did the worker then respond in another way back? We're really just keep asking why, till we get all the way down to the very bottom. It's so easy to be like, oh, well, it was because, they were frustrated. Okay, but why were they frustrated? Well, because they were denied medication. Okay, but why were they denied the medication? Because they didn't, have this additional screening test yet. Okay, why did the screening test not happen if the client felt like, it was time? Just keep going until we really get down, okay, well, the issue came down to, it's a scheduling issue that led to the lack of the screening, which then led to the delay in the blah, blah, blah. Okay, great. Let's address that, right? So it's really important for us to kind of understand the root behind it. Next thing is we're going to collect and review other information. So depending on the nature of the incident, records related to training, maintenance, inspections, audits, past incident reports may be relevant to review. So this is something that might potentially be done by whatever kind of leadership is involved in the initial building of the incident report, but could include other individuals. But it's really important that we're making sure that we have all of the information possible. So let's go back to that issue of, a client that's maybe acting out because they're frustrated about a service. If this is unusual, probably regardless, we're going to want to go through our notes, right, on this client and see, is this something that has happened before? Is this completely out of character? Is this an issue that we've had multiple times of scheduling being an issue and us not getting the proper testing done on time? So we're going to want to collect that data so that we can really do a comprehensive review and really get kind of at the root of what happened. And kind of the last point here is really making sure that not only do we do this process for, just when it's required for there to be reporting, but also investigating near misses. So, besides, obviously there's some really obvious times where we're going to need to report. So incidences that result in a fatality, an injury, or an illness is clearly like, yeah, that's reportable. But there's also these things called near misses, which is a situation that could potentially have resulted in death, injury, or illness that should also be promptly investigated. So near misses are typically caused by the same conditions that produce more serious outcomes or reportable incidences. And they usually kind of signal that there are some hazards that are not being adequately controlled for, or that previously have been kind of unidentified that do exist. So these are really important and can be a huge, huge asset to your facility to be able to identify, because near misses it's exactly what it sounds. It's something could have happened, but for whatever reason, whether it's a fluke in scheduling, an additional person showed up, so then we were in a good position and we weren't understaffed, or somebody went, the extra mile. They didn't have to, but they did. And so we were fine, but we could have not been fine, kind of given the typical way things would have operated. So these are also really important that we're documenting and doing these investigations and really evaluating them, because typically there will be some near misses before an actual incident occurs. And so this is a great way to catch the issue now and try and get this addressed so that we can support there being an actual reportable incidents later. Abby, anything to add here in terms of, I think that sometimes people get nervous to talk about incident reporting because then it's like official, and people are worried about getting in trouble or stuff like that. Anything to add from your perspective on the importance of incident reporting?
Yeah, I think a big takeaway is it's better to report and have the information, document it and just address it, acknowledge that it happened, and so we can learn from it and move on. I think it can be a detriment when you don't report it. And if people find out that something happened and it wasn't properly reported, that can actually look a lot worse and have other things come up that are going to be negative. So you need to follow the procedures and take steps to report it thoroughly and learn from it. That's going to be the best. That's going to give you the best outcome for your staff and the whole facility.
Absolutely. And that's not just on a leadership level, that's even on an individual level. I think it's easy, as an individual to be like, oh, I don't want to bring it up. I don't want to make it too official, or I don't want to get in trouble, or, give this negative feedback. But so often by being really transparent, like, this is the reality, it could help. The outcome might be that management's like, we need to hire more staff. Or there's a system that is failing our staff. It's not working. Or, all of our staff mentioned they would love training in X area. Like, let's do it. So, usually it's going to help improve conditions, definitely improve safety, but could improve other conditions as well. by just being transparent. So yeah, great point, Abby. Thanks.
Thank you. All right, let's pause for a true or false. Only reportable incidents should be documented and investigated. If you know the answer, press play and move on.
Hello and welcome back. As we talked about a whole bunch, the answer to this is false. Near misses should also be investigated and documented thoroughly. Often the cases that lead to the near misses will be what also causes actual incidents, reportable incidences. So important to document those so that we can address them before they become bigger issues.
So we want to tailor education based on roles and responsibilities, response expectation, and how the workplace violence plan could change and what happens if the workplace violence does change. So here we have a chart of staff education based on all roles. Training for all employees should include the workplace violence prevention policy, risk factors that cause or contribute to assaults, policies and procedures for documenting patients or clients' change in behavior, the location, operation, and coverage of safety devices such as alarm systems, along with the required maintenance schedules and procedures, early recognition of escalating behavior or recognition of warning signs or situations that may lead to assaults, ways to recognize, prevent, or diffuse volatile situations or aggressive behavior, manage anger, and appropriately use medications, ways to deal with hostile people other than patients and clients, such as relatives and visitors, proper use of safe rooms. These are areas where staff can find shelter from a violent incident, a standard response action plan for violent situations, including the availability of assistance, response to alarm systems, and communication procedures, self-defense procedures where appropriate, progressive behavior control methods, and when and how to apply restraints properly and safety when necessary, ways to protect oneself and coworkers, including the use of the buddy system, policies and procedures for reporting and record keeping, policies and procedures for obtaining medical care, trauma-informed care, counseling, workers' compensation, or legal assistance after a violent episode or injury. And then some additional training to consider for just leadership, recognizing high-risk situations so that they can ensure that workers are not placed in assignments that compromise their safety, encouraging workers to report incidents and to seek the appropriate care after experiencing a violent incident, and reduce safety hazards and ensure that workers receive appropriate training. Following training, supervisors and managers should be able to recognize a potentially hazardous situation and make any necessary changes to the physical plant, patient care treatment program, and staffing policy and procedures to reduce or eliminate the hazards. And then additional training to consider for security, psychological components of handling aggressive and abusive clients, and ways to handle aggression and diffuse hostile situations.
All right, thanks so much, Abby. Now we're going to move on and talk about how to use Hatch to reduce workplace violence. So we've talked a lot about risk factors, we've talked about prevention methods, we've talked about training, documentation. So what's Hatch's role and how can we help assist you in reducing it and coming up with a really solid workplace violence prevention program? Well, these are just some of the current available resources to all of our clients. If you're a member of the Hatch community, you will know that we are constantly innovating and trying to do more and constantly trying to improve our services. But so depending on when you're watching this, we might have come out with even more resources. But here are some kind of bare minimum recommendations for everyone to at least help or integrate into your workplace prevention program. So starting off with the training center. So there was a lot of really important trainings that were mentioned just earlier by Abby of trainings that support both leadership and security, as well as just all personnel. So our training center provides de-escalation, workplace violence, AMA blocking, boundary setting, and more. And this can assist in reducing and responding to workplace violence. For those of you who don't know, our training center is automatically organized based on requirements, whether you're Joint Commission, CARB certified, what state you're located in, and then also the type of position that you have at your healthcare facility. So if you are part of leadership, there's going to be some additional trainings for you. If you are part of the security team, there's going to be trainings in there as well. So Training Center is a great place to start in terms of just getting some trainings to go over topics, just like the topic that we're talking about right now. As we talked about earlier, near misses are really important that we document. We have a good catch / near misses form, which was created to empower frontline staff and offer a way for all staff to be open and honest about the need for improvement. What may seem like a small error or occurrence now could later potentially be a serious incident, and that's why we call it a good catch. So there's a form that can be used to report a near miss incident. It describes incidents where no property was damaged and no personal injury was sustained, but where there was whether it was a slight shift in time or position, damage or an injury could have easily occurred. There's also an ability to share this anonymously if you would like, but this is a really great tool that we encourage leadership to support their staff in using to be able to document this and identify issues, and then responses can be shared with relevant leadership team members so that they can evaluate it on a regular basis. Incident reporting form, another feature that's available to all staff that have a Hatch account. And so this is a form in Hatch that can be used for documentation of events that have occurred for later analysis and review to reduce future events. So this would be used for when there was an injury or property damage, loss of life occurs at a facility. You should be using the incident report instead of the good catch / near misses form. Next, we have a survey. It's the Employee Workplace Safety and Security Survey, which can be used to get important feedback from employees to address concerns in safety. These are things that could be both operationally concerns as well as things like staffing numbers and training resources and stuff like that. So this is a really great tool that can be filled out by anyone in Hatch, and results will go to relevant leadership so that they can evaluate. Infection prevention and controls is another form that can be used to track and evaluate existing infection prevention efforts, which can also be a part of workplace violence, and it also evaluates hazardous materials. So this is available for certain leadership positions to be able to evaluate and do regular checks on. The last really big form that we're going to pull out here is the facility walkthrough form. So this has the ability to review environmental risks or concerns that can assist in reduction of workplace violence. It's very comprehensive, and it can be organized by level of care. So whether you're a residential or an outpatient facility, this is a really great resource that's available to your leadership team to be able to do an analysis and kind of identify any potential concerns or hazards that exist at your building or setting or facility, and be able to document potential areas that you want to improve in the future. All right. I know that was a lot of information. I hope that was just kind of helpful to run through all of the resources that are available at Hatch to kind of help you all. As I had mentioned, there might be more resources that are available, or there might be resources that you all have made that you've uploaded into Hatch to help you. But I hope that this is at least a good starting block where you can use your Hatch account to really help support your workplace violence needs.
All right, so let's pause and do a pop quiz. What training topics should security staff be trained on to reduce workplace violence? Is it A, ways to recognize, prevent, or diffuse volatile situations or aggressive behavior, manage anger, and appropriately use medications? Is it B, ways to protect oneself and coworkers, including the use of the buddy system? C, policies and procedures for reporting and record keeping? D, all of the above? Or E, A, and B? Pause the video and think about it, and when you're ready, press play and we'll reveal the answer.
Hello and welcome back. If you selected option D, you would be correct. Those training topics are for all staff, including security team members. All right, everyone. Well, that wraps up all of our trainings for today. I hope this was really helpful in helping people to understand what workplace violence is, what are the risk factors, what you can do to help prevent it, how leadership can be involved in supporting, what trainings are necessary, and how Hatch can be a part of your facility's efforts to reduce. And, ideally, we would love for there to be no workplace violence issues in our partners' facilities. So I hope this was helpful. I hope you learned something new. As always, if you have any questions or concerns, please don't hesitate to reach out to your account manager here at Hatch. But thank you so much. We hope you have a great day. And that's all that we have today.
Bye, everyone.